Cervical cancer is the most common preventable cancer among Indian women. It is the second most common cancer affecting women worldwide after breast cancer. How many women do you think are aware about these preventable and fully treatable cancers? Not many. Especially in rural, underprivileged areas, women are mostly unaware of cancers that only affect them. Creating awareness among such women on the importance of preventive cancer screening is therefore pertinent because with early detection, these cancers can be fully treated while they become malignant and untreatable in the advanced stage. Basically, rural women do not go for preventive screening of these cancers due to their low educational level, family income status, their personal health-related beliefs and attitudes, shyness, and lack of adequate facilities for screening and treatment of these cancers in the nearby primary health centers. Besides, lack of transport also contributes to women's inability to reach health centers when faced with distressing symptoms of these cancers. To prevent the high occurrence of cervical cancer and breast cancer among rural women, several community awareness programs and screening health camps have been conducted by World Health Trust in Delhi NCR region since 2009, with facilities for registration, counseling, screening and referral. The villages of Gurgaon where such programs have been conducted are Sakatpur, Nawada Fatehpur, Hayatpur, Shikapur, Hassanpur, with support of DLF Foundation. The purpose is to spread awareness about the causes, risk factors, striking symptoms, precautions, importance of early screening, and timely treatment of the cancers that affect only women. The main challenge has been the mobilization of women of a village to participate in a cancer screening camp. For this, prior publicity of the event by pasting banners in the nearby areas, mic announcements, and house-to-house distribution of pamphlets are very useful. Besides, awareness talks and focused group discussions immensely help in motivating women to join the forthcoming screening health camp in their village. Specially designed, easy-to-understand leaflets on women's cancers are also distributed. This direct interaction with village women prior to the cancer screening camp is indeed very effective, as women are motivated to register for cancer screening to be done on a scheduled day. In the awareness camps, women are sensitized about the prevalence of the 4 women's cancers in our country. Cervical cancer that affects cervix, the lower part of uterus. Breast cancer that has its origin in the breast tissue. Endometrial cancer that occurs in the inner lining of the uterus. And ovarian cancer that originates in the ovaries where eggs are formed. Knowledge is disseminated about the risk factors and symptoms associated with each of these cancers, along with the importance of early screening and timely treatment.
बाथरूम से आ रही हैं, आपके हाथ गंदे हैं, उन्हीं गंदे हाथों से अगर आप खाना परोस रही हैं, खाना बना रही हैं, छोटे बच्चों को देख रही हैं, तो अब कितने इन्फेक्शन समझते हैं ना, कीटाणु का पनपना, तो कितने कीटाणुओं को पनपने के लिए मजबूर कर देती है। कीटाणु पनपने लगे तो क्या होगा? बीमारियां फैलेंगी। आप बीमारियों को खुद ही बढ़ाते हो। हमारे अपने हाथ में है ना सफाई रखें, हमारे अपने हाथ में है। तो सब सफाई नहीं रखोगे अगर आप अपने घर से सफाई नहीं रखोगे और अपने बच्चों को नहीं सिखाओगे सफाई रखना, तो बीमारियों को आप न्योता दे रहे हो कि बीमारियों आओ और हमको पकड़ो। लेकिन आपके घर में जो शौचालय है क्या वो साफ है?
खूब सफाई।
तो ये ना हो, इसलिए आप अपने जगह को जहाँ रहते हैं अपने घरों को देखिए सफा करते ही हैं। सफाई नहीं रखेंगी तो देखिए बीमारियां इसी से उत्पन्न होती है।
और घर की भी सफाई करो, लेटरिन बाथरूम सफाई करो।
सफाई करना सबसे नंबर 1 है काम।
हमारे लड़कों से पहले तो साबुन से हाथ धोगो और फिर इतनी सारी मट्टी लाओ। मैं बड़ी के बात है मट्टी भी के बोले मना मट्टी बिना नाकुआ मट्टी तो
मट्टी से नहीं करिए माता जी, साबुन लीजिए।
Personal cleanliness on the part of both men and women appears to be a crucial factor in the development of cervical cancer, as the principal cause of this disease is the persistent infection of cervix, the lower part of uterus, by a virus called the human papilloma virus. The high prevalence of cervical cancer in rural underprivileged women could be attributed to their poor genital hygiene and presence of sexually transmitted diseases which they are completely unaware of. Therefore, advocacy, communication, and community mobilization are essential components of screening awareness campaigns for combating cancer, especially among rural women. Needless to say, the ultimate goal of such cancer screening camps is to promote cancer prevention among the women community, reduce the number of deaths caused due to these cancers, and provide timely treatment to those affected.